Hello, welcome to my channel Kiddies Health. So today I'll be talking about the hand, foot, mouth disease. I think it's one of the most common viral infections that we see nowadays, and I think that most of the 90% of children has at least got one episode of this disease. So what do you understand from this hand, foot, mouth disease? So it's a very mild, it's very contagious viral infection that is seen in young children. Young children meaning it's seen in children below 5 years of age. So usually from 6 months to 5 years of age is the most common age group that this disease is common or prevalent. So what is the causative agent? So there is a Coxsackie virus which is belonging to a group of enterovirus which is causing this disease. And we all have a doubt like how does this spread? I think many of the mothers have had these questions like how does this infection spread? So it's mainly spreading through the secretions from the mouth, respiratory droplets and blister fluids. And these children who have hand, foot and mouth disease, they usually present with fever, sore throat, poor appetite. So after the 1 to 2 days of fever, they'll have painful sores formed at the back of the mouth. So initially they start as small red spots which later form into ulcers. So and later after 1 or 2 days they develop rashes which has flat or raised red spots. Sometimes blisters are formed, usually which is seen on palms and soles. If we find a child who has fever for 1 or 2 days, and after 1 or 2 days of fever, if the child develops oral ulcers or blisters on the palms and soles, the most common diagnosis is hand, foot, mouth disease. There is something known as atypical hand, foot, mouth disease. That is, these rashes are rarely seen over the knees, elbows and buttocks. So how long does it take to heal? It usually takes around 7 to 10 days and it spreads through skin to skin contact among children. So treatment is mainly symptomatic treatment such as to relieve pain. Because the ulcers which has formed in the mouth, it will be very difficult for the child to have food, so the appetite will reduce. So we should make sure that the child does not go dehydrated because they'll refuse even to take the liquid fluid. So we have to make sure that the child is well hydrated throughout the infection. So how can a teacher help? So most of the students, I think nowadays since the school has opened, viral infections are so common nowadays. So how can a teacher from the school pick up a hand, foot and mouth disease? So they can look out for children with fever, rashes, blisters on their palms and soles to ensure that the infected children stays away from school for at least 10 days after the onset of symptoms. So next I'll talk about the remedial measures for infected children. So these children should be isolated for a week and they should not be sent to school. And mothers, they should monitor the child's fever. Make sure, like I said before, the child should not get dehydrated. And because they have sore throat, we should avoid giving them spicy and oily foods because that will aggravate their pain. So we should avoid oily and spicy foods. Then ensure everything is sanitized, proper disposal of diapers and proper washing of infected clothes. And you should cut their nails and bath them twice a day. And give them room temperature food. And always verify with your pediatrician before sending the child to school. So that's all. I'm winding up my talk about the hand, foot, mouth disease. I hope this small talk on the infection was very useful to all of you. Thank you. So I'll see you in my next episode, Kiddies Health. Thank you.